Hi, my name is Amy and we're going to be doing an HEENT assessment today. Our client appears alert and in no acute signs of distress. So we're going to begin with the head and looking at the face. We can see that the skin is clear and intact. I'm going to have you tilt your head forward so I can look at your scalp. So we're just feeling here for any lesions. We have no noted lesions on the scalp. Hair is equally and evenly distributed with no signs of alopecia. And you can go ahead and pull your hair back again. We're going to move down to your face. And can you smile for me, frown, raise your eyebrows, and stick out your tongue? Okay, and you can close your mouth. I'm just going to palpate the masseter here. And open your jaw for me. Move it side to side. Good, so we know that cranial nerve 5 is intact and our masseter is well developed. We're now going to move on to your eyes, so I'm just going to lower the lighting in the room. So we're going to start with our Snellen chart to assess cranial nerve 2. I'm going to hold it about this distance from your face. Can you cover your left eye for me? Good. Can you make out the bottom line?
I can.
Okay, what about the second from the bottom?
CFDHJ.
Good, and can you go ahead and cover the other eye? Can you make out the bottom line with this eye?
No.
Okay. What about the second from the bottom?
CFDHJ.
Okay, good. You can uncover your eyes. So your vision is about 20/25. Do you wear glasses regularly?
Yes.
Okay. Now we're going to assess cranial nerve 3. So I'm going to check your pupils for reactiveness. You can just stare straight forward. Good. Good. So your pupils are about 3 millimeters and they're round and equal and reactive to light. And now I'm going to just have you following my pen. We're going to assess cranial nerves 3, 4, and 6 for extraocular movement. And look up. Good. So 3, 4, and 6 are intact. So now I'm going to just inspect your sclera. I'm going to look at the lacrimal duct and also at the conjunctiva below your eyes. So if you can stare straight for me. Good. And now look upwards. Okay, and I'm going to just raise your eyelids and you can look down. Good, so the sclera is moist and intact, no noted injection, and the conjunctiva is pink, moist, and intact. We can see that the hair is evenly distributed across your eyelids and on your eyebrows. So now I'm going to take my ophthalmoscope. We're going to do a fundoscopic assessment. So for this, I'm going to have you just stare straight past me, and I'm going to be looking into your eye. Okay. And we can see the red reflex in the optic disc. I'm going to have you turn your head so I can see your right eye. Now we're going to move on to your ears. If you want to pull your hair behind your ears for me. Okay, so your ears are both about midway down the head, symmetrical and equal. Do you feel any tenderness around the pinna?
No.
And the tragus?
Nope.
No noted discoloration. Going to assess your ear canal now. I'm going to pull down and back on the tragus. We have cerumen present. You can see the tympanic membrane is pearly gray and intact. I'm going to come around on the other side. And again, I'm going to pull down and back. And again, cerumen is present. The tympanic membrane is pearly gray and intact. And now we're going to move on to assess cranial nerve 8. We're going to start with the whisper test. I'm going to give you 3 words. Just repeat them out loud.
Red. Apple. 3.
Good. And I'm going to come to the other side here.
Red.
Good. Now we're going to move on to the Weber test to test for conduction. I'm going to go ahead and strike this, and I'm going to place it up on your forehead. I want you to tell me if you hear it more on one side, the other, or equal in both.
Equal in both.
Good. And now moving on to the Rin test. I'm going to strike this again. When you stop hearing it, I want you to let me know. I'm going to move it forward in front of your ear and let me know if you can still hear it. And then when it stops.
Okay.
Good. All right, and we're going to go again on this side. Good. So cranial nerve 8 is intact, and now we're going to move on to your mouth. Okay, so we are moving on to your nose and sinuses. So your nose is medial and symmetrical in the face. I'm going to go ahead and palpate your bridge. And do you have any tenderness?
No.
Okay, no noted discoloration. I'm going to go ahead and palpate your sinuses. Let me know if you have any tenderness. Do you feel any tenderness there?
No.
Okay. And now I'm going to assess for transillumination, make sure our sinuses are clear. You open your mouth for me. So transillumination is present and symmetrical on each side. And now I'm going to check inside of your nasal cavity. If you can go ahead and tilt your head back. Your septum is midlined, intact. Our mucous membrane is pearly, also intact. Good. And I'm going to have you smell this for me. Just tell me what you can smell.
Smells like coconut.
Good, so cranial nerve 1 is also intact. Now moving down to your mouth. You're symmetrical. I'm going to have you open wide for me. I'm going to take a look at first your buccal membranes, which are pink, moist, and intact. I'm going to go ahead and pull down on your lip to take a look at your gums. Good. Have you had any tenderness?
Mm-mm.
Good. Your gums are also pink, moist, and intact. Okay, so I'm going to have you stick out your tongue. Good, and lift it up for me. Cranial nerve 12 is intact. And now I'm just going to take a look at the hard and soft palates. Good. Good. So I'm going to test cranial nerves 9 and 10 now. I'm going to just tap the back of your tongue and check on your gag. Stick your tongue out for me, nice and far. Good. All right. And I'm going to have you swallow for me. And just tell me how that tastes.
Like water.
Good. Okay. And I just want to take a look at your tonsils. So open nice and wide for me. Good. And tongue down. Perfect. So tonsils are equal, symmetrical, no noted redness, no noted swelling. Okay, and finally we're going to move down to your neck. So it appears symmetrical. I'm just going to feel for your lymph nodes. Good. So they're soft, non-tender, palpable. And then I also want to check your carotid pulse. So just lift your neck a bit for me. Pulse pulses are +2. And I'm going to come behind you. I'm just going to palpate for your thyroid. But while I do that, I want you to swallow. Okay, you can tilt your head back a bit and try to swallow. Good. So the thyroid is non-palpable and moves with the trachea. And finally, I just want to listen for a bruit over your thyroid and the carotid arteries. I'm going to use the Bellamy stethoscope. Very good, and we have no brewery present, and that concludes our HEENT exam today. So now we're going to begin our respiratory assessment, and we're going to be starting posterior to our patient. Their skin is clear and intact with no noted discoloration, and now I'm just going to have you say the words 99.
99.
Again.
99.
Again.
99.
And one more time.
99.
So tactile firmness is present down the back and decreases as we go further down. And I'm just going to have you take a nice deep breath in. Good, and exhale. So we have symmetrical and equal rise. And take a nice deep breath in for me. Good, and one more time. And up. Good. So our diaphragmatic excursion is about 5 centimeters, which is within normal limits. And now we're just going to take a listen to the lungs. Every time you feel me place the stethoscope on your back, just take a deep breath in and out. No need to hold in between. Good, so our breath sounds are clear. We hear vesicular breath sounds and no adventition sounds are noted. If you could go ahead and turn around for me, we're going to do an anterior exam. Okay. And again, every time you feel the stethoscope, just take a deep breath in and no need to hold in between. Okay, good. Good, so lungs are clear and equal bilaterally. We have no labored breathing and breathing at about 16 breaths per minute, which is all within normal limits. Okay, so we're going to begin our cardiac assessment. And first I'm going to inspect at the neck and I'm going to look for any jugular vein distension, which we have none present. Good, and moving down from there, we're going to come down and I want to check your capillary refill. So our refill is less than 3 seconds on each side. We have no discoloration into the arms. I'm going to go ahead and check your radial pulses. Good, and our pulses are +2 bilaterally. If you want to lay down, I'm going to move on to your legs. Good, so we're going to start here at the femoral. And we have +2 pulses bilaterally in our femoral arteries. Moving down to popliteal. Good, +2 pulses, posterior tibial. +2, and dorsalis pedis. Also +2, and we have no noted discoloration to the legs. And capillary refills also less than 3 seconds in our lower extremities. And now I'm just going to fold your pants down a bit to inspect your abdomen. Good. So there's no noted pulsation in the abdomen. I'm going to go ahead and listen first for any brewery over the aortic, iliac, or renal arteries. And I'm just about 2 centimeters above to the left and right of the umbilicus. Good. No noted brewing. And now I'm just going to palpate, so you're going to feel some pressure in your abdomen. I'm going to feel for the aortic artery. So we can palpate the pulsation. And the artery is only about 2 centimeters in width, which is within normal limits. Good. And if you want to sit up, we're going to listen to your heart sounds now. Alright, so we're going to start with the aortic valve. I'm going to start on your manubrium here and come down to the angle of Louis. Now we can count our intercostal spaces. And we're going to go to the second and to the right side here. And I'm going to listen for your aortic valve. Good. And now moving to the right, we're going to see on our left intercostal space in the second, and this is the pulmonic valve here. Moving down to the third, we're now at Erb's point. And we're going to skip down to the fifth intercostal. Our tricuspid valve. And now moving from the fifth intercostal down midclavicular. Can you sit up for me? Good. And this here is a mitral valve, also known as our apical pulse. We have a clear S1, S2 heart sounds, which is a lub dub. And all of these are within normal limits and findings for our cardiac assessment.